We have a new administration with different priorities that don't include DEI and health equity. Do you think that this is a proper way to view nutrition? It's just a yes or no question.
With MAHA is should those processes be stronger?
Right. It's just a straightforward yes or no question. Is this a conflict of interest or is it not?
It could be
that somebody who is
perceived as a conflict of
advising
interest,
us
yes.
on what is nutritious
say-
food has a financial interest in a business that is trying to run cattle producers out of work.
In a recent House Oversight Committee hearing, Rep. Brandon Gill took on Dr. Eve Stoody, a nominee for a key role in U.S. nutrition policy. The exchange raised important questions about health equity, the role of science in public health, and potential conflicts of interest in the development of the nation's dietary guidelines. Let's break down the key moments from this heated hearing and why transparency is crucial in these decisions. Rep. Gill began by acknowledging the committee chair and highlighting the administration's goal to ensure Americans, especially children, have access to safe, nutritious food. He set the tone by stating that making America healthier is a priority. However, the questioning quickly shifted to Dr. Stoody and the concept of health equity. Rep. Gill asked Dr. Stoody directly, "What is health equity?" Dr. Stoody explained that health equity is about ensuring all individuals have equal access to healthy food and health care. Gill then pressed her on whether health equity should remain the central focus for all future dietary policies. This sparked a critical moment, with Dr. Stoody avoiding a clear answer. It became clear that the current administration may be moving away from the health equity framework that the previous one had championed. Rep. Gill didn't back down, referencing an article by Dr. Stoody in the American Journal of Clinical Nutrition that emphasized the central role of health equity in shaping the 2025 Dietary Guidelines Advisory Committee, DGAC. Gill asked if she still stood by this approach, but Dr. Stoody deflected, citing previous administration guidelines.
Dr. Stoody, I've got a few questions for you. First of all, what is health equity?
It's the consideration that all individuals have equal access to healthy foods or different aspects of the health system.
I think all individuals should ideally have access to healthy food. Do you think that should be the central lens through which we look at health?
It is certainly an area of research and discussion.
But the central lens, do you think that makes sense?
You're relating to the work of the 2025 Dietary Guidelines Advisory Committee that the previous administration did ask them to conduct their review of evidence with a health equity lens.
Well, are you familiar with this article entitled, it was from the American Journal of Clinical Nutrition. It's called Addressing Misinformation About the Dietary Guidelines for Americans?
Yes.
Okay. And were you an author of this article?
Yes.
Okay. I thought so. Your name's on the top. It's the second author. One of the statements in this says, quote, "In addition, HHS and USDA have prioritized health equity as the central lens through which all scientific questions will be considered in the 2025 DGAC." Do you think that makes sense?
That was the request from the administration, and that was carried in through the charge to the committee.
But do you think that this is a proper way to go about promoting nutrition?
It is one of the discussion points it's one of the topics that is being discussed.
Well, I'm asking if you think that this is a proper way of going about promoting nutrition in the United States. Your name is on this article.
My perspective on that is I think it's good to look at evidence in all ways, and that can include through that perspective.
Do you think it should be the central lens?
I did not. That was the request from our administration. But
you don't think that that's
is the charge?
You don't think that that's proper?
I didn't write the specific charge to the committee.
Well, your name is on the article.
Yes, and the article is talking about what the request was to the 2025 committee.
And I'm asking you if you think that is a proper lens to view nutrition through.
I think it is a lens that you can view nutrition through.
But is it a proper lens? Well, this says central lens.
Again, as a career employee in the Department of Agriculture, I implement the requests of our administration, and that was at the time with the Biden administration, the request.
Right, but we have a new administration with different priorities that don't include DEI and health equity. Do you think that this is a proper way to view nutrition?
I think it, as I've mentioned, that it is appropriate to look at literature in every.
So you're not going to answer the question respectfully. We can move on then. I would thought that would be a simple one. You're familiar with the scientific report of the 2025 Dietary Guidelines Advisory Committee, is that correct?
Yes.
And you're familiar with the members who wrote that, who were on the Dietary Guidelines Advisory Committee, right?
Yes.
Got it. One of the things in this same article, which you wrote as a bit of you said misinformation, which you're attempting to dispel, is that there are no conflicts of interest. Is that correct?
The discussion is that conflicts of interest was considered in the process to establish the Dietary Guidelines Advisory Committee. I think conflicts of interest, whether real or perceived, is an extremely important conversation in nutrition science.
Right. One of the members of that committee is a man named Chris Gardner. He's a practicing vegan. He's an environmentalist activist. Receives funding from a company called Beyond Meat, which is trying to run cattle producers out of business, wants to move towards plant-based diets. Do you think that that's a conflict of interest, that he is on this panel advising the United States in an official capacity about what foods are nutritious and what aren't, whenever he has a obvious financial interest in Beyond Meat?
I'm not, I will say that conflicts of interest were reviewed by our
I'm just asking if it is a
Office
conflict
of
of
Ethics
interest.
within the Department of Health and Human Services who chartered the committee. I think that those things should be disclosed and discussed. And the department, the administration was aware of those affiliations.
So that is a conflict of interest. Is that your testimony?
I'm not an attorney in ethics.
Neither am I, but it's pretty obvious, isn't it?
Well, if you're talking about a financial conflicts of interest, that is something that our ethics attorneys review and assess. So I do not do that review of our members in that process. We do have individuals who support.
So your testimony is that you don't know if this is a conflict of interest or not?
Well, I will say, I mean, there are processes, and I think part of what the
It's just a yes
conversation
or no
is
question.
with MAHA is should those processes be stronger?
Right. It's just a straightforward yes or no question. Is this a conflict of interest or is it not?
It could be
That somebody
perceived
who
as
is
a conflict of
advising
interest,
us
yes.
on what is
also
nutritious
say-
food has a financial interest in a business that is trying to run cattle producers out of work.
Her reluctance to take a definitive stance raised concerns about the administration's priorities on national nutrition policy. The questioning intensified when Rep. Gill brought up potential conflicts of interest in the advisory committee. He cited Chris Gardner, a member with ties to Beyond Meat, a plant-based food company. Gill questioned whether it was appropriate for someone with financial interests in a company that promotes plant-based diets to influence national nutrition policy. Dr. Stoody's response, deferring to ethics reviews, didn't satisfy Gill, who emphasized the need for impartiality when shaping such critical policy. Rep. Gill's sharp questioning underscored the need for transparency in how nutrition policies are developed and how taxpayer money is allocated. He pointed out that while social issues like health equity are important, the primary focus should be on issues that directly affect the safety and well-being of Americans, such as law enforcement and economic security. As the hearing concluded, Rep. Gill reiterated his concerns about the lack of transparency and accountability in nutrition policy. He emphasized that while health equity is important, it should not overshadow the need for sound science and fiscal responsibility. His relentless questioning made it clear that any public health decisions must be grounded in integrity, transparency, and evidence-based practices. If you agree with Rep. Gill's stance on health equity and transparency, leave your thoughts in the comments below, and don't forget to subscribe for more updates on the latest political debates and hearings. Rep. Gill's approach serves as a reminder that in public health and policy, integrity and accountability must come first. Stay informed, stay engaged, and keep demanding transparency in government decisions that impact all Americans. Thanks for watching The Left Wing Critic, where politics meets passion and we hold power to account. If you're tired of corporate spin and left-wing noise, hit the subscribe button, like the video, and join the movement. The left doesn't stay silent, and neither do we.